This pharmacology topic is glucocorticoids. Let's start with reviewing some pathophysiology related to corticosteroids. The term corticosteroid refers to glucocorticoids, mineralocorticoids, and androgenic sex hormones as a group. Corticosteroids are regulated by the hypothalamic pituitary adrenal axis and are synthesized as needed by the body. The image on the right shows the hypothalamic pituitary adrenal axis. Stress, like inflammation or trauma, causes the hypothalamus to secrete corticotropin-releasing hormone, or CRH for short. This activates the anterior pituitary gland. It releases adrenocorticotropic hormone, also known as ACTH, which then causes the adrenal cortex to secrete cortisol, which is the primary corticosteroid. When cortisol levels accumulate, they act as a negative feedback mechanism to shut off the production and release of CRH and ACTH so that no more cortisol is released. Glucocorticoids are steroid hormone drugs. They're structurally similar to cortisol and regulate metabolism and the immune response. Glucocorticoids perform many functions within the body. The image on the right shows the mechanism of action for glucocorticoids, which is a bit different than other medications. Glucocorticoids enter the cell and then bind to glucocorticoid receptors that are located in the cytoplasm. The glucocorticoid receptor complex then binds to the DNA within the nucleus to upregulate or downregulate gene expression. This leads to a wide range of effects, including suppression of inflammation, suppression of bone formation, and increased glucose production or gluconeogenesis. It also causes increased gastric acid secretion. Now, because the medication has to influence gene expression to work, it does take some time before you will see the effects. They aren't immediate as they are with some of the other types of medications. Glucocorticoids are commonly used for their anti-inflammatory properties, but because of their range of activity, they also have many adverse effects as well. You can easily recognize a glucocorticoid by its name. These often end in S-O-N-E, or SONE, or L-O-N-E, LONE. Some of these names you may be very familiar with, such as prednisone and dexamethasone, betamethasone and hydrocortisone, fluticasone, budesonide, and prednisolone and methylprednisolone. Thanks to their many different effects within the body, glucocorticoids are used to treat many conditions. Certain conditions cause increased levels of chronic inflammation or lead to a lack of glucocorticoids, such as cortisol, within the body due to effects on the adrenal glands. They can be used chronically to treat primary adrenal insufficiency or Addison's disease as a direct replacement for the missing adrenal hormones. They can be used to suppress the immune system and inflammatory response following organ transplantation. This can help prevent organ rejection. Glucocorticoids are commonly used in autoimmune conditions like systemic lupus erythematosus and inflammatory bowel disease. This all goes back to suppressing the inflammatory response. Asthma and COPD are caused in part by inflammation in the bronchioles that narrow the airway and make breathing difficult. Glucocorticoids are great for helping reduce inflammation in the airways and help clients breathe better. Glucocorticoids can also be used to treat cerebral or spinal cord edema caused by a tumor. They can also be used acutely to treat things like allergic reactions, which those treatments can be topical or systemic, sepsis, and status asthmaticus, which is a prolonged and severe asthma attack. When glucocorticoids are used chronically, they are typically given orally. When used acutely, they are often given as an injection. Let's talk about the adverse effects of glucocorticoids. Long-term therapy with glucocorticoids can lead to complications and severe side effects. Think steroids cause the 7 S's. Now, this stands for sugar changes. Remember, glucocorticoids increase blood glucose. Clients with diabetes mellitus should be very vigilant when taking glucocorticoids, since they can cause hyperglycemia and hypokalemia. Sepsis. Glucocorticoids can increase the risk of infection since they suppress the immune system. They can also mask existing infections. So all fevers, even a low-grade fever, should be investigated and reported to the healthcare provider. Swelling from sodium and fluid retention can also occur. This can lead to weight gain and hypertension. They can cause skinny bones and muscles due to decreasing bone formation. Clients should be monitored for the development of osteoporosis while taking these medications. This is particularly important for children as their growth may be restricted. Stomach problems, such as gastritis and ulcers due to the effects on gastric mucosa, sight changes like glaucoma and cataracts with long-term use, and sadness due to mood swings. They can even cause psychosis. One particularly noticeable adverse effect is Cushing syndrome, which is characterized by some distinctive features. This tends to happen with long-term glucocorticoid therapy. Now, the image on the right shows what a client with Cushing syndrome may look like. A wide, round, or moon-shaped face can develop. Cervical fat deposits can also form along with truncal obesity. Fluid retention is happening everywhere. Glucocorticoids break down different layers of the skin, leading to fragile skin and easy bruising. Clients can also have other skin changes like acne and hirsutism. This is caused by changes to androgen hormones. Oral corticosteroids have several administration details to keep in mind. They should be taken in the morning with food. Now, this does 3 things. It mimics the body's natural timing of cortisol secretion, which usually occurs in the morning. Taking these drugs earlier in the day also helps reduce the risk of sleep disturbances. Taking it with food helps reduce adverse gastrointestinal effects. Long-term use of oral corticosteroids requires that the dose be tapered when discontinuing. They should not be stopped abruptly, since this can cause acute adrenal crisis, which is a life-threatening condition caused by not having enough cortisol. Oral corticosteroids can cause mood changes and weight gain. Clients should be encouraged to maintain regular physical activity. Physical activity helps reduce weight gain and decrease bone loss and osteoporosis risk. Dietary changes can also help with weight management and bone loss. So increasing calcium and vitamin D intake can help strengthen bones and reduce the risk of fractures. Taking corticosteroids can decrease potassium levels, so clients may need to increase their potassium intake. Low sodium intake can help reduce fluid retention. Increases in blood glucose can happen and should be reported if they occur. Concurrent intake of NSAIDs should be avoided due to the increased risk of gastric irritation. Glaucoma or cataracts can develop while taking the medication, and any changes in vision, such as blurriness or loss of sight, should be reported. Corticosteroids decrease immune function and, as a result, increase the risk of infection. Clients should try to reduce the risk of infection as much as possible. This includes taking proactive measures like avoiding large crowds and staying current with recommended vaccinations. And speaking of vaccinations, clients on long-term corticosteroids should not receive live vaccines. This can cause more harm than good in those clients and can lead to infection. Monitor clients for and report any signs of infection, such as fever. Topical glucocorticoids may also be used. Now, there are different types that exist. We have lotions, which tend to be thinner and absorb quickly. There's creams, which are slightly thicker, and ointments, which are the thickest and absorb more slowly. No matter the formulation, these all work by reducing inflammation and itching that happens with certain skin conditions. These can be used to treat a variety of skin conditions like eczema, psoriasis, contact dermatitis or allergies, and insect bites. Topical glucocorticoids are very effective, but can cause adverse effects, especially if they're overused. Stretch marks or skin striae can form and acne can develop. Skin thinning or atrophy can also occur, especially in areas like the groin, the face, or underarms. When topical glucocorticoids are used on these areas or sensitive skin, milder strengths are preferred and only a thin layer should be applied. This is why it's so important to teach your clients to avoid using these drugs on the face, groin, underarms, or even near the eyes. Do not use these with occlusive dressings unless prescribed or instructed to do so by the healthcare provider. This can increase absorption of the medication and may unintentionally increase the dose. These drugs should only be used short-term to reduce the risk of these adverse effects. Now let's shift gears and talk about inhaled glucocorticoids. These are often used to treat asthma and COPD. Inhaled glucocorticoids are administered via a metered dose inhaler or dry powder inhaler most commonly. The image on the right shows an example of a metered dose inhaler with a spacer. Inhalers help deliver medication deep into the lungs, while the spacer acts as a chamber to hold the fine particles of the drug in until the client is able to inhale all of the medication. This is especially helpful for clients that have trouble timing their inhalation with depressing the medication canister. Spacers are not required for dry powder inhalers, which makes them a bit easier to use. Proper inhaler technique is crucial for the effectiveness of inhaled glucocorticoids. Clients should be taught how to use inhalers correctly and have their technique checked regularly. Once the inhaler is depressed, the client should take a big breath in and briefly hold it. The spacer allows them to take another breath in if they need to get the full dose. Once the inhaler is depressed, the client should take a big deep breath in and briefly hold it. The spacer allows them to take another breath in so that they get the full dose. They can cause oral candidiasis, which is a fungal or yeast infection in the mouth or throat that appears as white patches or sores on the tongue, mouth, or throat. This can happen due to local immune suppression within the mouth and usually requires treatment with an antifungal agent. Clients can prevent it by rinsing their mouth after taking the medication. These drugs can also cause hoarseness. This is why it is so important to remember these key client teaching points. Using a spacer helps the client get the full dose of medication. Always rinse the mouth after each use. This helps prevent oral candidiasis. Oral candidiasis can be painful for some clients, so they should be routinely inspected for oral patches or sores to help detect it early.